And joining us now on the Book Talk segment of the show, great pleasure to welcome Dr. Julie Silver today. She's an assistant professor at Harvard Medical School, also the chief editor of books at Harvard Health Publications. She is the author of a really great series of books, Chicken Soup for the Soul. This one is titled Say Goodbye to Back Pain, and I know a lot of people suffer with that in many different degrees. Dr. Julie Silver joined us by telephone today. And Doctor, thanks for joining us. How are you?
Thank you. I'm doing well.
Good to have a chance to talk to you. And I guess next to the common cold, probably back pain is probably the most prevalent health issue. I guess just about everybody at some point in their life goes through, don't they?
It's really true. I think that back pain is one of those things that's almost inevitable, and I always make the comparison with my patients to having cavities. It's not realistic to go to the dentist and say, hey, I never want to have a cavity, make that happen.
Right.
And it's probably not realistic to go to the doctor and say, I never want to have back pain.
Is it getting worse? I mean, you do see ads on TV for different remedies or things you can buy to alleviate it, or are we just talking more about it?
Well, I think we're really talking a lot more about it. Certainly, the things that often people think protect them from back pain, like having a sedentary type of job, may actually predispose them to back pain. So if you sit at a computer all day, well, it may not seem like you're stressing your back the way farmers would, perhaps, or laborers would, but it is actually really hard on your back to just sit all day.
It really is. I mean, you almost have to get up. I try and do that. If you're sitting by the computer a long time, just get up every hour, just walk around for a minute. I mean, that seems to help. Particularly for tall people, I'm 6'5", and not necessarily have to be tall to get back pain, but taller people tend to have more of it, don't they?
Well, it's true that when you're taller, a lot of different seating situations are not really made for you. I bet that when you were in school, you kind of were crammed into desks and so on,
right.
and in airplanes and cars and all of that.
Yeah, that's right. The school desks, those old ones that were one size supposedly fits all, but that wasn't true even then.
No, I mean, imagine you compared to a 4'10" woman. I mean, that's just a really big difference, and you're not going to feel comfortable in the same kind of seat.
Now, this particular book in the series of Chicken Soup for the Soul, this one has different stories from people who have either recovered from injuries or surgery, right, to the back, and how they are dealing with that?
Right. This actually is a new series from Chicken Soup for the Soul, and the idea behind this series was to provide health information from Harvard Medical School with narrative stories. So people really know Chicken Soup for the Soul stories. Most of your listeners are probably familiar with those stories. But in this new series of books, including Say Goodbye to Back Pain, their stories are interspersed with medical advice about how to deal with that particular issue.
And I guess, obviously, like anything medical or health-wise, prevention is the best way. But what are good ways to prevent it? I know my dad used to do a lot of stretching exercises. I try and do that as well. I guess that's one way, right, to try and prevent back pain?
It is. And going back to that dental example that I gave, I put a chapter in the book on brushing and flossing your back, because certainly people know that brushing and flossing your teeth helps to prevent some problems, and if you do have a problem, hopefully it won't be so severe. And the same is true really for your back, and some of the things that really help with that include your posture, where you're sitting at home and work, having a lumbar support, making sure that the seat fits you well, your feet are on the ground, and so on. A firm mattress when you're sleeping, trying to keep the core of your body really strong. So that middle part of your body, we call that core strengthening. And also just what you said, moving around. Your body does not want to stay in the same position. Even if it feels like you're in the perfect position, your body only wants to stay there for a few minutes.
When you look at pictures of the spine and the back, or even x-rays of it, it really is kind of amazing that it even works at all. There's so many parts to it.
There are so many parts, and that's one of the difficult things about diagnosing back pain is trying to find that precise structure that's actually causing the pain. Is it a tendon, a bone, a muscle, a nerve, and which one?
It's a combination of like you said, tendon, nerve, and bone. I mean, and it's not one big piece either. I mean, it's all like a puzzle, isn't it?
It really is. One thing connects to the other, and that song, you know, your hip bone connects to your knee bone.
Right.
That song that you sing when you're a kid. Doctors think about that all the time. If this is connected to this, and this is connected to that, and so on. And it is. It's one big, very complicated puzzle.
As a physician, Dr. Silver, is that one of the hardest areas of the human body to diagnose accurately? Like you said, sometimes it takes people years before they get it, diagnosed properly, back pain, right?
It's true, and sometimes it's very obvious what the problem is. Sometimes we'll get an MRI on someone, and we'll see a big disc that's herniated, that's pushing on a nerve, and they have numbness and tingling down their leg, and we know exactly what the problem is. But other times it is a lot more elusive, and we're not quite sure what the problem is. The pain is not as specific, the injury not as obvious, and that's very frustrating to doctors and to patients.
How about when it comes to surgery? You hear a lot in sports. Athletes tend to have back surgery, but that they try and avoid that as much as possible. You hope that can heal, but the back is like we said, it's a difficult thing to heal on its own, depending on what part of it is injured, right? I mean, discs don't heal, don't they? But other parts can. So it's a difficult balance there, isn't it?
It is a difficult balance, and there are really three main reasons why people generally consider surgery. One is that they've had back pain for a while and it's just not responding to non-surgical intervention. So if there's an obvious problem and you've tried other things and surgery potentially could help, then you're sort of left with considering that as an option. So that's one reason. Another reason that's a little more serious is if somebody's getting weaker. So if they have a lot of pressure, for example, from a disc on a nerve, and the nerve supplies the muscles, that's another reason. We don't want people to get weak and develop problems like they can't run or their leg gives way and they fall or whatever. And then a third reason that is, not as common but very important to consider is if someone is having problems with their spinal cord or the end of the spinal cord, the nerves at the end called the cauda equina, and if there's pressure in that area, which is often manifested by bowel and bladder symptoms, so urinary incontinence, that would be another reason why someone would have surgery sooner rather than later.
Is I guess in all medicine, technology is getting better, but particularly in treating the back, are there new things coming out all the time that are helping?
There are new things coming out all the time, and a lot of times what I tell people is to get a second opinion, and many people who have back pain, they've already gotten a second opinion or even a third opinion. And in that case, sometimes I say that it's a good idea to switch specialties and see a doctor from a different medical specialty, because some of the new things that are coming out are utilized in various specialties. Orthopedists may use one type of procedure, and pain anesthesiologists may use another, and physiatrists and neurologists and rheumatologists, different things. And so those are all the kinds of medical specialties. Those are all MDs. Who can potentially treat people with back pain, but they would approach it in various ways.
Well, the name of the book is Chicken Soup for the Soul. Say goodbye to back pain, filled, like we said, with about 24 different stories of people who have undergone treatment for back pain, how they're coping, and how they're getting better. And we've been talking with Dr. Julie Silver today. And Doctor, give out a website people can get a hold of the book or get a hold of you if they like.
Sure. My website is juliesilvermd.com, and the book can be purchased on Amazon.com, and you can probably find it in Sam's Club and all kinds of places.
Great. Doctor, appreciate you taking a few minutes today. You're doing good work up there in Harvard, and hopefully we can talk to you again sometime. Thanks for being with us.
Well, thank you. I appreciate it.